Our top story first. Now, there are lots of misconceptions around dental health and oral hygiene. Some of us tend to believe that brushing your teeth rigorously is going to ensure white teeth, or flossing is going to lead to gaps between your teeth. Many of us don't even use the tongue cleaner because you're afraid to do so. Why is this? The fact is that there are way too many misconceptions around oral hygiene. This report is debunking all the myths around oral hygiene. Take a look.
If I brush harder, my teeth will be cleaner. I don't really need to deal with bad breath. Popping mint will solve it. I can't get a dental X-ray. It can be dangerous. Pregnant women should not go to a dentist. I have crooked teeth, but how can I wear braces? Is that not for kids? These and many more myths around oral health prevents us from getting the right kind of attention our teeth and gums deserve. We are busting a dozen of these myths and our experts are weighing in on each one of them. Do you have yellow teeth and brush till your gums bleed? Then stop immediately. It's important to brush your teeth thoroughly. However, brushing too hard can wear down the enamel and cause discoloration and sensitivity. In addition, brushing too hard may also damage your gums and even cause them to bleed and recede.
Brushing harder is not technically recommended because it results in erosion of teeth surface. Cervical abrasions, there are terminology called abrasion, where when you brush with a hard brush, you get cervical abrasions. These are cavities on the side of the teeth. So you need to use a medium sized brush, neither it should be very soft or neither very hard, because the process of brushing is you are physically scrubbing your teeth surface. If it's very soft, it's not going to do the purpose. If it's very hard, it's going to result in wear and tear of the tooth structure. So it should be a medium bristle, medium type of brush, and you have to do it in a proper angulation, proper way, so that it does the required effort, which is the very purpose of doing it.
While we all love chewing gum and the fresh breath it leaves us with at least for some time, this is not the solution to bad breath. It is not to say that chewing gum does not have its benefits for oral health. However, it is never a replacement for brushing your teeth. Sugar-free gum can help displace bacteria in the mouth, increase saliva production, and freshen your breath, but it will not remove the sticky plaque that builds up on your teeth.
Chewing gum is basically a habit. It's fine if you are doing it in moderation, because the muscle of mastication, the temporomandibular joints are all functional when you are doing chewing gum. But with excessive problem is when you are doing excessive chewing gum, the joints can get a lot of wear and tear. Although it results in salivary production, which results in cavities, but that is again up to a limit. Excessive use of anything is damaging the ligaments and the teeth and the gums.
The other lie that people believe is about dental X-rays being dangerous. It is far from the truth, say experts.
Dental X-rays for the last many years have become very safe. We do digital X-rays. They consume almost 80 to 90% less radiation. We use something called as RVG, radio visual graph. So hardly 10 to 15% of the total power is used to take the X-ray, and they have all the latest CMOS sensors. So they result in very less radiation. And for pregnant ladies, there are thyroid collars, front full body shields. So dental X-rays are absolutely safe to do, but again they are all technique sensitive, so the operator should know how to use them.
Pregnant and avoiding a visit to the dentist? Don't. The hormones associated with pregnancy may increase the risk of gum disease. About 50% of women develop gingivitis at some point during their pregnancy. So it's important for pregnant women to be extra vigilant about their oral health and not to skip their routine dental checkups and cleanings.
So one of the things that would-be mother should definitely be looking at is getting her oral hygiene to the best of health, because there's a lot of conversation on gestational diabetes, but nobody's talking of gestational periodontitis. I see a lot of pregnant women develop bleeding and swollen gums. This happens if you've not got a good oral hygiene done before you conceive. So the second trimester is the time when pregnant women can visit a dentist and should visit a dentist if they do have any decay or any complaint in their mouth.
Another common misunderstanding is around fluoride. A lot is being said about fluoride in toothpaste and how it can be dangerous. What is the truth?
The right quantity of fluoride is present in most toothpaste and it really helps. But too much of fluoride in certain areas in the world where there is, tube well water and stuff, that's a lot of fluoride in it. So that causes fluorosis, which causes weakening of the calcium component of the tooth. So that causes dark spots and brittle teeth. So that's when there's too much of it. But just the right proportion, the right quantity of fluoride in the toothpaste is in fact advised by most dentists because it keeps your teeth protected.
We also tend to put off a visit to the dentist until the time there is a problem. But the fact is, you make the future dental treatment more expensive by doing this, and hence periodical checkups are important.
Prophylaxis is basically very routine, basic cleaning of your tooth, which involves your cleaning of your gums and cleaning of your tooth. And this is very important so that if you are not visiting your dentist on a regular basis, later or sooner you're going to develop the diseases called gingivitis or the periodontal disease, which I've already mentioned about that.
Not knowing what is a myth and a fact can be dangerous for your oral health. This can lead to unhealthy habits that can cause tooth decay, gum disease, and other health problems. With Sneha Mordani in New Delhi, Bureau Report, India Today.